Well, it's
Yeah.
an absolute pleasure to meet you, Rick, and just
Oh,
to be
you
able
as
to
well.
thank you in person, really, because uh, your program has turned my life around in so many ways, and it's just been a week, and I haven't even started on anything but the somatic yet. What can I say? What can I say? I feel like a different person. And I really, from the bottom of my heart, thank you, because I've been living with this. I'd written myself off as disabled. And, that carries a burden emotionally and mentally. And I didn't realize how much I'd been, and then it was like after that first somatic exercise, I felt, oh my goodness, I feel different, and as the week's gone on with the habits, sitting differently, walking differently, I just feel like a new person. Wow, if I can fix myself even more, that's just more than I ever expected. If I just stayed like this, I'm still so glad I didn't have the hip replacement.
It makes it all worthwhile for me to have created something that can help someone so far away, living at the edge of the sea, who I've never met.
And for a long time now, for nearly 2 years, if to roll over in bed, I have to lean, grab something and pull. And without thinking, I turned, swung my legs and got off the bed. It's purely doing that somatics. And you may know better than me what happened during that exercise, because it's just back sort of,
Yes.
a lot of back sort of flexing and breathing. Didn't really feel like I was doing anything, to be honest, during the exercise.
That's the beauty of the somatics. And that's especially for people who are sensitive or have really, are fearful of starting something new, or are just in a lot of pain. The somatics is the best place for them to begin for these reasons. It's gentle. You don't think anything's happening, but what they're working on are these deep fascial lines of tension in our bodies that are occurring in patterns that are hurting us.
And I got up and, doing the walk, and, you want to click your fingers as you go and sort of think you can feel that motion in your hips, and they're moving in a way I don't remember them using for ages. It reminded me of dancing. I used to love to dance. That knee that has got so much better has been troubling me for 10 years.
Wow. But Denise, did you have x-rays or MRIs
Yes.
of your knees or your hips or anything?
When the x-rays came back, he picked up the wear and tear in my left hip. He thought was really bad, and he was recommended I go to see a surgeon to look at a potential hip replacement. So that's what I did, and eventually thought I've got to go and see the surgeon. And he actually condemned both hips and both knees, said I'd got a turn, a valgus knee, a leg length discrepancy, a short leg length discrepancy, but not
That's one of my pet peeves.
Yeah, half a centimetre or so, and a curve in the spine.
Yeah.
And his recommendation was a staged approach to replacement, starting with one hip, then the next, then the knees, and then we'll look at your back, he said. And at that point, I didn't really know what to do, because I'd been out for a walk along the promenade, local beach promenade, and I struggled even with a cane. And I thought, I think I'm looking at a mobility scooter next. And so I ummed and ahed, and I said, I'll go for the hip replacement, and I actually scheduled it in.
Can I explain to you my take on what you have described to me as what the doctors have said that you have? Okay.
Yeah, absolutely.
So valgus knee is a knee that comes in like this.
Yes.
All right. So with each step, this is happening to your knee. It could be because your foot is flat. It could be because you don't have strong hips. It could be that you have what I call an anteverted femur. Okay. Or you could have all of them to some degree. So anyway, the knee comes in, but when the knee comes in, the pelvis or hip typically wants to rotate forward and down, which creates an asymmetrical pelvis. What you were told is that you have a curvature in your spine. This is the curvature, right?
Yeah.
So it's not that it's a structural curvature, it's a functional curvature. And so with this, when this happens, it makes it appear that you have a leg length discrepancy, but
So
you don't really.
It's the other leg, right?
Yes.
The leg length discrepancy is the other leg, not that leg.
Right. Yeah. So because this goes down, the other hip comes up.
Comes up. Yeah.
Right. And so what you're thinking is, so when most doctors or PTs or chiropractors or whomever look at a leg length discrepancy, they look at you standing and they see one pelvis higher and they say, oh, you've got a leg length discrepancy. Absolutely not. It's completely a compensation for other issues happening either in the other leg or the same leg. That's what the lateral, and in medicine, when they see a lateral curvature, they call it scoliosis, which is a scary term. We all think, oh my gosh. Well, all it just means is this. So you straighten that out and lo and behold, the scoliosis is gone. What I believe, Denise, is that, and you haven't even started on my pain reduction portion. So, but what's happened likely with you is that you've developed something called an anterior femoral glide syndrome, which means that the femur head is shifting forward in the hip socket. And what that does is it breaks down the cartilage in the hip socket and causes labral tears and bone spurs. It can cause front pain of the hip. It can cause side pain. It can cause back pain. It can cause global pain and be diagnosed as arthritis. But that hip strengthening exercise that you're doing is starting to correct the tracking for you. And once you get to the pain reductions part of my program, that will also help correct the tracking issue here and resolve just about all of this stuff.
I think this all goes back 10 years to a bilateral foot surgery.
Oh.
When I started to do your walk and to think about my position and my habits, I started to use all of my foot. And the first thing I felt was my bunion area pain. And I think that's, for me, been the powerful thing about the somatics is they really encourage you to think about what you're doing and ask your body to do something different.
Yes.
When you combine that with your daily habits of how you're sitting, how you're standing, how you're walking, how you're turning over, it all starts to sort of click into place.
Gosh, so Denise, it just warms my heart to hear you say that, because that's my message, is that, you know, these habits are the kernel of the problem, and they're creating these tighter, weak muscles. And yes, you can correct the tighter, weak muscles, but if you don't fix these habits, it's going to keep coming back. And the way you're saying it, I mean, I don't know how else to say it so that people can hear it, you know, and it's just great to hear you say it too, that, that's the key.
You say it, you make it sound, well, no, you make it sound easy, because it really is that easy. And it's almost like it's too easy to be credible. We want that hard route to things, you know. To get that level of flexibility in a hip that was just about to have surgery is pretty phenomenal, I think.
You're stepping outside of yourself to analyze your own movements and understand where you need help. And that is so critical for people to do. And you're doing a beautiful job of it. It just makes me so happy. You're just doing it just exactly how I hope everyone does it, right? Is that I'm trying to get people to think about themselves in that third person so they can see what's going wrong. And you're doing exactly that. I love it. So thank you.
Well, more people need to benefit from this. You know, how many people like me have already had hip replacements, or, you know, are suffering from that chronic pain and disability? They're miserable, you know, they're emotionally down. It's having such a huge impact on their life, and there could be an answer for them around the corner. And, you know, I want to shout it from the rooftops, really, because, you know, this is massive. This is amazing.
I mean, you are really out in the middle of nowhere, and you may have just one physio available to you. And if they don't understand these kinds of concepts, then what are you going to do? And so
No.
this is for a lot of the people who live where there's no other choice. You've got to help yourself in some way.
Living in remote northwestern England, up on the Scottish borders, with the sea, the Irish Sea out in front of me. I know, it's amazing, isn't it? So there's nobody in the world that you couldn't reach with this program and help.
But to answer your other question or comment is that I've also created an online training program to teach other health and wellness practitioners this method of solving pain, because I truly believe, Denise, that if everyone knew it, not only PTs, but personal trainers and yoga instructors and Pilates instructors, because they're all dealing with movement, we could really take a big chunk out of chronic pain in the world if everyone just understood how this all works.
I'm between 60 and 70% compared to what I was. The knee was a bonus because I wasn't expecting it to heal my knee at all. I was not expecting an improvement in my knee. It was all about having a better hip. I'm sitting now. Normally my hip would be painful. I'm sat and I'm completely pain-free. I feel like I'm ready to do a bit more.
Yeah. And that's what the pain reduction phase is, right? So I like your idea of doing the somatics one more week, because who knows how much more tension you can remove from your body and what else you'll learn. What if you just started, work one pain reduction exercise into your somatics routine? Yeah. Maybe do that at the end of one of the somatics lessons or beginning or whatever, because the somatics will release any tension that you've developed from that exercise anyway. And that way you can try one at a time. Because you have that lordotic posture, I think you'll find that your thigh muscles are very tight, the front of your thigh muscles, and that will be a critical one for your back pain. I love your creativity and your willingness to apply it in different ways. And that's really, this program is meant to, I want you to make it right for you.
I thought that when you got to the point where they say you need a hip replacement and your range of motion was gone, I thought that was permanent.
It would be if you hadn't tried to solve it. There's lots of cases where people's one glute is completely atrophied and the other one isn't, and therefore they're lying in this rotated position because of it, right? So there's all sorts of reasons for that. So I wouldn't shoot so much for perfect symmetry. I would shoot for better than it was. Don't forget that you haven't even begun to address the thigh tightness that you have.
No.
And so the tightness in the thigh can rotate the whole pelvis forward on one side more so than the other, causing the pattern that you're experiencing here too.
We look out at the hills from our house, the beautiful fell walking that we could do. And I gave that a long time ago. And, it would be a happy husband, I think, if I could join him on a 5-mile hill walk. So,
Well, I think one of the nice things that you're learning, Denise, is to, like, if you run into an obstacle, you're learning to think about, okay, what am I doing? Yeah. And if hill walking is one of your goals and you find that there's an obstacle with that, you now have the tools to think about, okay, why is this an obstacle? And what do I need to solve here to get this to happen? And you can do that. All right, okay. Denise, thank you so much. Enjoy the rest of your day.
You too. And again, thank you from the bottom of my heart, because you've given my life back. It's fantastic. Your program's fantastic.
Oh, well, thank you very much. It warms my heart.
Denise's story is important because it highlights this idea of tension as a driver of chronic pain. How do I know that tension was a driver of Denise's pain? Because the somatics that are found in my home programs unraveled so much of her pain. In fact, 70% within 1 week. So I want to explain briefly about why somatics is important and how it is completely unique to most approaches to solving chronic pain. Somatics is really short for Hanna Somatics, which was developed by Thomas Hanna and is a technique to reduce tension patterns in the body. He identified 3 primary tension patterns. However, you can apply Hanna Somatics techniques to any movement in the body. But basically, it's a unique technique that reduces tension in the body. I studied Hanna Somatics for about 3 years to learn these techniques. I don't know of any other medical practitioner who would go through that kind of training to, to learn these techniques. But I found with my chronic pain patients, something was driving their patterns of dysfunction in their body. And it was as if their bodies were locked in these patterns of tension. And that's when I discovered Thomas Hanna's work and decided to explore it. And it has made all the difference in how I treat chronic pain. It was the last piece of the puzzle that I needed to solve just about all chronic pain that walked into my clinic. It has also made a difference for the therapists who worked at my clinic too, as I trained them in some of these techniques to help them unravel their patients' pain as well. And they saw the same types of results. So in my home programs, I have 8 somatics lessons that are designed to unravel patterns of dysfunction in the body that lock the body into chronic pain. For Denise, this was a key, a big key to her success. As you heard, she had bilateral foot issues, knee issues, hip issues, and low back pain. And she was actually looking at starting to use a mobility scooter because she could no longer walk well at all. Within 1 week, she had unraveled a lot of that pain, and it gave her a new lease on life. And this is not uncommon. When we solve the source of problems in our body that are leading to our pain, usually results happen very quickly. Now, Denise was an extreme example of that. I wanted to share this story with you because it was so dramatic, and she had given up so completely on solving her pain. Her doctors had told her, she needed a hip replacement. They were going to look at spine surgery, knee surgery, all sorts of problems, surgeries to fix these problems, when in reality, it was a little known idea in medicine about neurally driven tension patterns that are locking the body into pain. So I hope you enjoyed her story, and thank you.